I chose to study at Monash Medical Mildura because it had such a great reputation.
This hospital is a recognised teaching hospital. It's got 146 beds. It's got consultants across all disciplines.
The advantage of the base hospitals is that there's a lot of things get done, you get a lot of experience, and you're not really competing with a great number of people.
The regional and rural areas for training for medical students these days is such an advantage, not only just the lifestyle and community of the people that you work and live with, but the training and the different clinical opportunities is just far greater than what you get exposed to in the city.
They have a lot of direct contact with consultants and registrars. They get a lot of hands-on experience, so they get to know very early in their training what it's actually like to be a doctor.
One of the things we've got here is we've got a good sim lab, so we've got an adult simulated person which you can practice your adult resuscitation on. We've got Sim Mum, which is for the women's health, doing the delivering babies. We've got the Sim Baby, and we've also got the Sim Neonate.
There's so much happening all the time. Code blues, code reds, codes yellows, going left, right and centre, and for a third-year medical student being thrown into that environment, it's fantastic. My normal day in third year was walking around the wards with the doctors, the interns, the consultants, being part of the team. From day one, you're thrown right in there.
My students, when they're in women's health, we'd do ward rounds in the delivery suite, see the gynae patients, and then they'd come across to my rooms and sit with me. And if I go to theatre, they come to theatre with me. I expect them to scrub. If there's deliveries on, then they're expected to come follow me for a delivery.
Students who come to Mildura have the opportunity to participate in teddy bear hospitals, where they will go out to primary schools and interact with young kids to help to demystify hospitals should a young child need to attend. Students will also have the opportunity to participate in a range of community health screening programs on an ad hoc basis as they become available.
I think the student accommodation here in Mildura is the best in Victoria for Monash University.
The best thing about living with the people you're also studying with is that when you go home, you're surrounded by people who are egging you on, they're helping you study. It's more than just going home and having someone to talk to about your day, debriefing. That's really important. On top of all of that, you're also surrounded by some great friends who you can then cook dinner with, have a glass of wine with, go out on the town, just have a nice relaxing time.
The fifth year accommodation is actually on site right next door to the hospital. So the fifth years when they're here on rotation, whether that be for anaesthetics or for surgery, if there's any emergencies going on or any special procedures or things that happen, they can just sort of run straight across and be involved and get their hands into whatever's going on to be part of the team.
I think it's just a great place to learn, a great place to get experience, a good place to live, great weather.
Everyone's friendly and you get to know each other, and a lot of the other students joined local basketball teams, football teams, netball teams. Got the river there, so on the weekends you've got Apex Park and you go rowing and skiing and that sort of thing, and really have that extra life on top of the hostel life where it's so much easier to get involved and be a part of. Would I come to Mildura as a student? I would say definitely, there's no way I would want to go anywhere else.
Definitely coming to Mildura, I've learnt a lot more. I've been able to get more hands-on than some of my city counterparts. So I'd recommend Mildura to anyone, whether it's a medical student, a nursing student, physio, any health science related course, I would recommend coming to Mildura.
We have a really high pass rate. Students do extremely well in their exams, and we find that they are work ready. They have had significant clinical experience, so when they hit the wards first day as interns, they are prepared.